Hey everyone, it's Dr. Emma. Let's be honest for a second. For most men, having healthy erections isn't just about sex. It's also a sign that your blood vessels, nerves, and hormones are working the way they should. And if you're trying to have children, an erection is obviously a pretty important part of the process. The problem is that millions of men struggle with erectile dysfunction, especially after the age of 40. One thing I always tell my patients is this: before you can understand why something goes wrong, you first need to understand how it's supposed to work. So today, I'm going to show you exactly how an erection happens inside the body. Don't worry, I'm going to keep everything simple, easy to understand, and actually pretty interesting. By the end of this video, you'll know what's happening inside your body every time an erection occurs. And who knows, you might even impress your partner by explaining the science behind it. So, let's jump right in. First, let's talk about what an erection actually is. Simply put, an erection happens when the penis becomes larger, firmer, and stiff enough for sexual activity. It sounds simple, but the process is actually incredibly complex. Your brain, your nerves, your blood vessels, your muscles, and your hormones all have to work together at exactly the right time. If even one part of that system isn't working well, erections can become weaker or disappear completely. So, what starts the whole process? Usually, it begins with some kind of stimulation. That stimulation can come from your mind or from physical touch. For example, maybe you see someone you're attracted to. Maybe you hear your partner's voice. Maybe it's a certain smell. Or maybe it's simply your imagination. Believe it or not, your brain alone can sometimes trigger an erection. Physical touch is another powerful trigger. The most sensitive part of the penis is the head, also called the glans. This area contains thousands of nerve endings. When it's touched, those nerves immediately send signals toward your spinal cord. Interestingly, those signals don't always have to reach your brain first. Your lower spinal cord has built-in reflexes that can start an erection all by itself. That's why some men with certain spinal cord injuries can still have erections, even if they don't fully feel the stimulation. Pretty amazing, isn't it? Now, let's look at the part of your nervous system that's really responsible for making an erection happen. It's called the parasympathetic nervous system. Don't let the long name scare you. Think of it as your body's rest and relax mode. When you're calm, comfortable, and feeling safe, this system becomes more active. It helps you digest food. It slows your heart rate. And yes, it also helps create an erection. That's one reason stress can be such a big problem. If you're anxious, overwhelmed, or constantly under pressure, your body switches into fight or flight mode instead. When that happens, your brain focuses on survival, not reproduction. Your body isn't thinking about romance, it's thinking about staying alive. That's why stress, anxiety, and poor sleep can all make erections much more difficult. Now let's talk about another major player, testosterone. Most people think testosterone is only about building muscle, but that's just one small part of the story. Testosterone affects many different parts of your body. It helps maintain healthy bones. It supports muscle strength. It influences where your body stores fat. It helps produce red blood cells. And just as importantly, it affects your sex drive. If your testosterone level is low, you may notice that your interest in sex decreases. You may also find that getting or keeping an erection becomes more difficult. That doesn't automatically mean low testosterone is the only cause of erectile dysfunction. Many men with normal testosterone still develop ED because of poor circulation, diabetes, medication side effects, or nerve problems. But healthy testosterone levels are definitely an important piece of the puzzle. This is why I always encourage men over 40 to know their numbers. You routinely check your blood pressure. You check your cholesterol. So why not check your hormones too? A simple blood test can tell you a lot about what's going on inside your body. Now, let's move down to the penis itself and see what actually fills with blood during an erection. Inside the penis are 3 long cylinders of erectile tissue. Think of them as 3 expandable tubes. One sits underneath, the other 2 sit side by side on top. The bottom one surrounds the urethra, the tube that carries urine and semen out of the body. Its main job is to keep that passage open during ejaculation. The 2 larger cylinders on top do most of the work during an erection. Inside these tissues are countless tiny spaces that can rapidly fill with blood. You can almost think of them as thousands of tiny balloons waiting to expand. Running through these tissues are important arteries that constantly deliver fresh blood. So now we have all the pieces we need. We have the brain, we have the nerves, we have the blood vessels, and we have the erectile tissue. The only question left is, how do they all work together to create an erection? That's exactly what we'll cover next. And if you're finding this helpful, don't forget to click the link in the description for my 9 free intimacy tips for couples. Also, tell me in the comments, what city are you watching from today? I always enjoy seeing viewers from all over the world. So how does an erection actually begin? Let's walk through it step by step. There are usually 2 ways the process gets started. The first begins in your brain. Maybe you see someone you're attracted to. Maybe you're thinking about your partner. Or maybe you're simply remembering an intimate moment. Your brain recognizes those signals and sends messages down your spinal cord. The second way is through physical touch. When the penis is touched, especially the head of the penis, special sensory nerves immediately send signals back to your spinal cord. Most of the time, both of these pathways are working together. Your brain is involved, and so is physical stimulation. Once those signals reach the lower part of the spinal cord, they activate a group of nerves that control erections. Doctors often remember this area with a simple phrase: S2, S3, S4 keeps the penis off the floor. It's a funny saying, but it reminds us that these nerves are essential for normal erectile function. Now here's where things get really interesting. Those nerves release chemical messengers that tell the blood vessels inside the penis to relax. One of the most important chemicals is called nitric oxide. You don't have to memorize the name. Just remember this. Nitric oxide tells your blood vessels to open up. As the arteries relax, much more blood flows into the erectile tissue. At the same time, the tiny muscles inside that tissue also relax. That creates more space for blood to fill. Imagine blowing air into a balloon. The more air you add, the larger and firmer it becomes. The same thing is happening here, except it's blood instead of air. As more blood enters the penis, it starts to enlarge and become firm. But there's another important step. If the blood simply flowed right back out, the erection wouldn't last very long. So your body has a clever solution. As the erectile tissue expands, it gently presses against the veins that normally carry blood away. Those veins become partially compressed. Less blood can leave. More blood stays inside, and that's what helps maintain a firm erection. In other words, an erection isn't just about blood flowing in. It's also about keeping that blood there long enough. That's why healthy blood vessels are so important. If the arteries can't deliver enough blood, or the veins can't hold it in, the erection may become weak or difficult to maintain. This is one reason erectile dysfunction can sometimes be an early warning sign of heart disease. The blood vessels in the penis are much smaller than the arteries around your heart, so they often show problems years before heart symptoms appear. That's why I always tell my patients, don't ignore changes in your erections. Sometimes your body is giving you an important health warning. Now that we understand how an erection happens, let's talk about something just as important. How does an erection go away? Because your body has to be able to start the process and also know how to stop it. An erection is maintained as long as the signals from your brain and nervous system continue, and as long as blood remains trapped inside the erectile tissue. But when the stimulation stops or after orgasm, your nervous system changes. The signals that were keeping those blood vessels relaxed begin to decrease. The smooth muscles inside the erectile tissue tighten again. The veins open back up. Blood can flow out of the penis, and gradually the erection returns to its normal state. This entire process is controlled by an incredible balance between your nerves, your blood vessels, your hormones, and your brain. And this is why erectile function is such a fascinating topic, because an erection is not just a male organ problem. It involves your entire body, your cardiovascular health, your nervous system, your mental health, your hormone levels. Everything is connected. Now, many men ask me, Dr. Emma, why did my erections become weaker as I got older? And the answer is, aging itself is not the only reason. A healthy 40-year-old man can absolutely have normal erections, but as we age, we are more likely to develop conditions that affect erectile function. Things like high blood pressure, high cholesterol, diabetes, smoking, excess body fat, chronic stress, poor sleep, and lack of exercise. All of these can damage blood vessels and reduce blood flow. Remember, an erection is a blood flow event, so anything that hurts your circulation can also affect your sexual health. This is why taking care of your heart is one of the best things you can do for your erections. Regular exercise, a healthy diet, maintaining a healthy weight, managing stress, getting enough sleep. These aren't just recommendations for living longer, they're also recommendations for maintaining a healthy sex life. An erection requires teamwork between your brain sending the signal, your nerves carrying the message, your hormones supporting the system, your blood vessels delivering blood, and your erectile tissue responding properly. It is truly one of the most complex and fascinating processes in the human body. I hope this video helped you understand your body better. And remember, understanding your health is the first step toward improving it. If you found this video helpful, make sure to like, subscribe, and share it with someone who might benefit. And don't forget to click the link in the description to get my 9 free intimacy tips for couples. Also, leave a comment below and tell me, what city are you watching from? I would love to know where our community is growing. Thank you so much for watching. I'm Dr. Emma, and I'll see you in the next video.